Dear patient, you are loved and you are thought about by many different people that you may not know, and we are here to care for you.
Today, I'm so excited to share an interview with Dr. Mona Amini. She is a licensed and board certified psychiatrist who has taken an incredible journey away from traditional medicine because she wasn't satisfied with the care that she was able to provide for people. Now, she's able to blend the things that matter most to her: music, mental health, the human experience, and science, and create the conditions that help people thrive, no matter if they're young or if they're in advanced stages and even progressing with dementia. I have Dr. Mona Amini with me today, and I'm so honored and excited to have you. Oh my gosh, you have just an incredible story, and all the things you're doing. Like, you have taken your role as a psychiatrist into a whole different realm, right? Like,
Yes.
you're showing, just like the medical community, I think in general, that they can exist and be successful outside of the traditional box of how they've learned to be and to function, which is so amazing. So I'm so proud of you for doing that. But I'd love for you to introduce yourself and just share a little bit more about your journey and how you got to where you are today and what you're working on.
Yeah, absolutely. Dr. Mona Amini, adult board certified psychiatrist, have over 10, almost 10 and a half years of experience in mostly administrative and executive spaces of clinical care and mental health. And after a certain amount of time, I just decided to go about things on my own for many, many different reasons, but mostly so I can create and make another type of impact on the world and the community around us about mental health and that destigmatization and really forming a bit more of a thought leadership role that spans outside of just clinical medicine and clinical psychiatry. So I developed a one-on-one concierge private practice in North Scottsdale called Navi Mind Wellness. So it's kind of a spin off of my name a little bit. So it's pretty fun. And that's more wellness centric, wellness forward. It's not just typical traditional psychiatry. We do a lot of talk therapy, talk about supplements, lifestyle changes, and if it's appropriate, we discuss medications as a treatment plan. And then I do some business work, consulting, but like the fun aspect of probably the last about 8 months that we see a lot more of Mona is in the creative space and really delving into the experiential space with music as medicine or music as therapy.
And it's amazing because I've come to two of your events already so far, and
Yes.
they're so profound. I think I was crying the last time actually, but it was amazing. And I'm curious, was there something that happened? Like you said, there were a lot of reasons why you kind of wanted to step away and step into this amazing space, but was there some moment of I have to do this? Like, it's a non-negotiable for me to stay this way anymore.
You know, yes, there were multiple. I think in terms of kind of going out and really, really dialing in and doing things on my own individually, that happened right before I was about to turn 40. And 40 for me as a woman was not what 40 was like in generations prior, where we learned that the woman kind of goes downhill and that's the extent of their life. And now, it's more caregiving than for their family and their kids and their mothers or fathers. For me, it was, you know what, I'm going to really dive into my authentic and genuine self and not have to shrink anymore because I'm really tired of it because I'm about to turn 40, and the fact that I've had to do that for so many years and so many decades around friends, around family, around professional environments felt to me that it was unfair at that point in time. And I've worked this hard to get to this level. Now is the time that I want to just give it a try. Let me see how things go.
And shine.
And yeah, yeah, and just be myself in doing that. So, and then less than a year ago, I had really dialed into my own love and passion of EDM, electronic dance music, and what it meant and how it created this like safe space for myself all these years. And I've always had a dabbling of love and passion for music. I used to play piano a little bit, had a very brief stint with the violin, but always was like this girl that would burn the CDs and make playlists for my friends and sometimes legally, not illegally, Napster.
Napster. I remember Napster.
Oh
Oh my
yes,
gosh.
oh yeah, and I'd burn the CDs and I'd make these beautiful elaborate labels for them and gift them to my friends or at that time my boyfriend and I were dating. It's not my husband, but I'd make a playlist for him, DJ'd certain things like, and DJing at that time was CDs and vinyls and things like that. But delving back into that and letting my creative, passionate side out and learning to interweave that connection of the mind and mental health with what music can do for you and what it had done for me and what it had done for my friends. And in a space where I wanted it to be created where you could feel that energy and feel that connection and the influence and impact of that in a positive way without the influence of substances. So I started doing the sonic immersions, which are the not your typical meditations, in a treatment center that I actually medically direct as kind of like a trial to see how things would go and what that would mean to that community. Because most of these people were in a residential treatment center, 30 plus days, there for all sorts of types of addiction. And trauma and other circumstances and disorders. And the feedback was amazing each and every time. And so I brought that then into the general public. And as you had shared, the sonic immersion in a yoga studio, wanting it to be more of an immersive experience and creating that and just elevating it each and every time, each and every experience and journey. And it's been long been my passion. And then that kind of led to the DJing,
Oh my gosh. Which
the DJing academy and all of that fun stuff. So
it's amazing. Actually, I was like, okay, you're definitely my idol now because I've been looking into DJ schools because I love music too.
yeah,
Like it's
yeah.
so healing and therapeutic. And I want to
Yes.
dive into that too. But yeah, like I think you're like a rock star DJ. So
Thank you.
that's amazing. Help me understand and help like the audience understand what is this connection between music and the mind and why is that so important?
So it depends on the music, it depends on the level of what you want out of the music. But the thing I resonate with the most is electronic dance music because for especially high performers, our minds are wired to be like just
All the
firing
time.
on all cylinders at all times. So when I would get into a mindset where I really wanted to get into a meditative state and I had like ambient music or classical or jazz or something, I could never get to that achievable state of mind where I felt like I had clarity. And I kept questioning myself, why am I not getting to this state? There has to be something more. So researching into it, but finding that every time I had some lo-fi, some specific like frequency of music on that was EDM, or getting into a state of, let's say, like Rufus or Nora on Pure or like a Ben Bomer, lyrics or none, it would get me into that state almost immediately. It was like sucking me right in.
Yeah.
So knowing that and creating that trajectory of, okay, that connection with this and the mind and the mental health, what am I missing? And what can I create so that I can replicate this for the public and make it really cool? And also help people on a different level that might not be feeling safe or they feel like they're going to be judged if they were to go to an event or a concert or a rave or a festival because they're older or they're professionals and creating it into a different type of experience for that subset.
Yeah, and I think what I really enjoy about the practice is it's this combination of like meditation mindfulness
Mhm.
with the music
Right.
that really just lets you like drop into yourself
Yes.
and be present in the moment. Because like you said, those of us who are like, we're super busy and just,
Right.
it's hard to find that space where you can just be. And these practices allow you to just be in the moment.
That's right.
I love
That's
that.
right. And that's why we've got kind of the meditative component of it that I created that definitely has that mindfulness component that, I ask people to drop in and journal, write their intentions and the clarity that comes out with that. The feedback that I get after each and every session, there's at least a handful of people that tell me they solved the next week or month's problems just in that 60-minute session
Yeah.
alone. And then what else I created was more of the movement side. So something that is more high energy, that is same with the EDM, but like more activating, more think of like, your typical DJ in a festival or like a day club type of
You're
vibe.
dancing it out.
Yeah, you're dancing it out because movement is also medicine. That dance, that experience, the dopamine surges, you're releasing certain elements of stress, the oxytocin of this being in a community and like kind of general more than 5, 10 people setting really creates a very different vibe. And that's the whole purpose, that everybody there is intentionally there to help themselves in any which way or form. So
Oh
it's
my
beautiful.
gosh.
It's beautiful. And I love leading, and that was the reason why I decided to go to DJ Academy and just learn these things myself because number one, I had the big passion for it. Why not? Right? Mona's always the person like, I can do that myself. Let me give it a try. Not to say in any which way or form I'm comparable to some of the best DJs out there, but this is a different space and I have a different type of hat that I'm wearing
Yeah.
when I'm leading these types of sessions.
Mm-hmm. It is. Well, it's a different experience,
Oh
right?
yeah.
It's
Yeah.
intentional in a different
Mhm.
way.
It's a journey.
Whereas,
It's a journey for sure.
yeah.
Yeah.
Oh my gosh. So now you're operating this space where you're using music and you mentioned a few things like the oxytocin and the neurotransmitters and how that's affecting people. Is there anything else like they should know about that like how the music can really benefit them, like a takeaway for someone who's listening?
Yeah, I think music in general, it doesn't have to be EDM, but just music in general, there are different levels, different frequencies, different genres that can help you focus more, give you more energy, help with chronic pain. We
Mhm.
have in some of these dementia nursing centers, for example, they'll play overhead music that's very intentional that you and I, if we were general public, might not think of that. It's just background music. That's helping them to feel calm. And that helps to kind of neutralize any of like the emotional ups and downs, the sundowning that might be experienced later in the afternoon. It's very intentional.
Okay. Oh, that's actually a really great point too, because
Yeah.
I know there's a lot of people that have a loved one that have cognitive and they have dementia. And as nurses, right, I think we use music as often as we can for
Yes.
distraction techniques, helping with pain and just reducing anxiety. Like it definitely works. Like we see it. I'd be so curious for someone who does have a loved one, like what are just some of the things that they can do for someone with dementia specifically that they can use with music?
Probably the most researched is that genre, that generation. If you know that your loved one, for example, absolutely loved the Beatles. And that was like their band. They knew every single word to every single song on those albums. Play that for them. Because you'd be surprised, and these are true, like research and scientifically proven cases where even if they have a pretty moderate dementia, the severity level, despite that, if you've played something that is from their past that really, really resonated with them, that impacted them in a positive manner, they could be taken and transported back into that. You might see a little highlight of joy and happiness with them. And it's pretty significant. There are levels of individuals that were artists previously
Mhm.
that have, let's say they had dementia or they're having a case of dementia that is worsening in severity over time. Those individuals, despite the severity, have been shown to know the lyrics to their songs still. They knew, the notes. If you started playing maybe the first several notes, they'll know immediately that that was their song. They'll create that connection. It's a very different brain and cognitive function music
Yeah.
there's not only the emotional component, there's a cognitive component, there's everything to it. And I
Yeah.
think it's beautiful and it's ancient. This is not anything that we're just studying now. These are thousands of years in the making.
Mhm. I used to love, so I don't know if you know, but I started off as a neuro
Mm,
nurse at Barrow,
mhm.
and we had a lot of people that had brain injuries. And I remember some people, right, just because of like how the brain is organized and how it processes information. There would be certain patients that, like, if we would go and sing to them, like
Yeah,
sing the questions to them,
yeah,
they would, like, receive the information
yes.
differently and they would participate differently. And just like, that was just like my highlight of like learning in neuro, is just like how powerful, like, the music is for the brain, just like even structurally,
Oh, yeah, yeah.
beyond anything else.
Oh,
So
absolutely. I think that in a way, what I'm doing not only helps myself because I'm learning, if you will, a new instrument, because the DJ deck, a controller, it is a significant instrument. I'm learning every day, more and more, and I want to eventually get into production as well. So that's my next step. You'll see that too. Not that I have enough on my plate, but the component of learning a new instrument as we grow older, you and I in our 30s and our 40s and beyond, learning something new like that helps to prevent dementia.
yeah.
We're learning new opportunities, new instruments, new things that are going to keep our brains wired and active in a very different manner when all we're doing nowadays is just we're connected to screens. We're connected to phones and iPads and laptops and TVs. This is a very different and intricate purpose. And, my kids see what I'm doing too. And my youngest is so just he had a concert and music artist t-shirt day today, and so he wanted me to purchase a DJ shirt for him because he said that's mommy,
Oh,
and his favorite DJ is Fisher. So it that was really meaningful to me. So it was beautiful. But they get to see that and they see this burgeoning woman, this leader that was a physician that does all these other things. But guess what? She can create another outlet for herself and pave the way too. So I'm just being myself. I'm just being who I am and who I've always been and just diving into things and we'll see, what carries me and
yeah.
moves me along.
Oh my gosh, that's amazing. And so there's that part of you, and then there's like the still practicing with the
Yeah.
concierge psychiatry.
Yeah.
And we're seeing, I think, a lot of movement of people now actually wanting to pay for the care that they want.
Yes,
Like, they
finally.
want to be heard. They
Right.
want a different experience. I just love your thoughts on what would make an experience with you. What does that experience look like versus something that they get from just like a regular insurance covered visit?
The reason really why I went into concierge is just that because the delegation of insurance payers is what runs this country and the healthcare systems. Like it was something that dawned on me very early on, and I thought that it would get better over time. And if I was a leader as a physician at the top in the C-suites in those boardrooms, I can make that difference and be heard. That was not the case. It's pretty remarkably sad. And so with concierge, somebody should know that you finally, kind of like generations ago, you have your doctor at your beck and call. So my patients text me, they'll call me, they'll email me, they have side effects to something or they question something. We'll have check-in calls that might be, a few minutes, but they're walking into a keynote they're really nervous about. Can you remind me what we worked on last week in our talk therapy session? And let's work through that. I'll help them guide themselves in a mindfulness just right before some board meeting or another large task, or just navigating life with them. And that's what I went into medicine for. I didn't go into medicine to deal with billing and insurance every year, just decreasing our compensation or healthcare systems not allowing for whatever, type of patient care to exist. Um, we're dialing into an environment in healthcare nowadays, especially in this country, where because healthcare is ruled by insurance companies and different systems, it's all revenue based and bottom line, and that's it.
Yes.
And I don't know if patients really realize that. Patients feel like it's the doctor or the physician or it's the provider or it's the office. It's not. It is the healthcare system and the insurance payer. Because when you get ripped apart and you say, for this particular visit, you used to get $100 in reimbursement for that patient for 20 minutes. Now you get 35. That doctor and that office now has to increase their volume and increase, the quantity of patients they have to see in one fell swoop, that now they can't lose money. They still have a salary to pay and staff, to hire and not have turnover. So it's a daunting system. Concierge completely eliminates that. So it's kind of like having your doctor on call back in the 1950s, 1960s. And if you know that your patient is hospitalized at a system, you're giving those doctors a call. Hey, what's going on? How can I help? Can I get the lab work? We're actually complementing care, what should have been today. And we take time. None of my patients, in their visits are less than 30 minutes. We have a 30-minute visit or we have a 50 or 60-minute visit. Our initial sessions are 60 to 90 minutes because I really want to get down to the history and get to know and build a relationship with that patient.
Yeah. It's really hard for anyone to build a relationship when the insurance dictates that you have to see like 10 people an hour,
Yeah.
right?
And mental health, you can't do that.
And you
You
can't.
really can't. And that's why I think nowadays psychiatry has gotten such a bad rep, because when I went into psychiatry years ago, it had a level of, we could still do some sort of therapy and we can do medication management. And now it's like the therapy, we're not going to compensate you for that. Or a psychologist or an LCSW master's level can do that. So we're not going to allow you to do that, or we'll pay you very, very minimal for it. And so a psychiatrist is going to say, if my 15-minute visits, 4 of those in 1 hour, is going to compensate me more than a 60 or 45, 60-minute visit with one patient, why would I take that alternative?
Yeah.
And that's what's happened. So you're getting a check-in with your doctor as a psychiatrist. How are you doing today? Do you have any thoughts of harming yourself, ending your life? How are the side effects? None? Okay. Refill.
Continue
Done.
as is.
That's it. That's not care. I mean, you think about like being in this chair and being in this space and finally getting a moment to breathe. And by that time, that's at least 5 to 7 minutes.
Yeah.
And then you can get into the mindset of, okay, now I can talk about how my last week, month, has been, and we can focus on that.
Yeah.
Unfortunately, we're not there anymore.
Well, but fortunately, that's where like people like you and I come in, and
Yes.
we're providing the resources for
Right.
people to actually access care that they deserve,
Right.
that our system doesn't allow us to provide the way we should, right?
Correct.
And I think there's so much talk about like the moral distress, moral injury of all the clinicians. And I think a lot of it is because at the end of the day, you just think about all the things you wish you could have done differently
Mm-hmm.
instead of like thinking about all the things that you did that were really impactful.
And a lot of that is from time, by the way, or lack of time.
Yeah.
If only you had a little bit more time as a nurse or a clinician to have looked at it differently or spent a little bit more time with the patient to really deduce something that would have been another alternative treatment plan that you could have presented to them instead.
Yeah. I'm curious what your thoughts, and this can be like for the mental health space or just in general. Um, what is like one thing that you think people should know that would be important for them to hear? Like just something that like the wisdom you wish that you knew before you walked into an appointment.
Um, there's a lot. uh, on the patient side and from the patient's point of view, I want patients to know that there are other alternatives that exist for them. So just because you're attached in a way to a healthcare system, you must see the providers or clinicians in that office. That's not true. You can still go in network with another office. You can still go out of network, pay a little bit more in your copay and your deductible, but see the person or providers that really resonate with you. Because the thing with mental health in general too is it is very, very important for you to find somebody that you can trust,
Yeah.
that you feel like you can have this confidential space that's just between the two of us and trust your provider. Be honest with them because me as a clinician, as your physician, I can't help you if you're not going to be forthcoming with me and honest with me. And there are times where something hasn't been told to me in other systems, not in my practice now, but in other systems where they were fearful of if somebody found out that they, were using an illicit substance like marijuana, or if they were taking something else that wasn't prescribed or it was prescribed by a PC, like their PCP, their primary care. Um, or they just did feel like this was a match.
Yeah.
And that's okay. But patients feel like they're stuck. And when you feel like you're stuck, you're not going to go to your visits. You're going to no show. You're going to cancel. And then you're also not going to follow your treatment plan because you don't feel like what your clinician has ordered or what they're planning for you, you're not going to agree with. Why should I go? So then your mental health deteriorates, and then it's a whole other
Spiral.
cascade of issues.
Yeah.
So that's why direct primary care, we're seeing a lot more of. We're seeing a lot more concierge practices in every specialty now, because not only have providers burnt out, they're they're just tired of the systems. They're tired of having to deal with the billing side of things and not getting compensated for like a year or more. And they just want to treat the patient. That's what we signed up for at the end of the day. That's all we care about, not the other, tasks and things.
Yeah.
So,
No, you raised a few really good points that actually I want to circle back to one of them. And I think there's a lot to be said about shame in healthcare, right? Like, I always wanted to create like a really safe environment for the people that I was caring for to be forthcoming and share everything. And they may see it as like, oh, I'm like ashamed of whatever it is, whether it was a diagnosis or something that they've gone through in their life, but they don't realize how impactful that piece probably is to everything that's happening. And I don't I don't really feel like in my experiences with my colleagues, physicians, nurses, everyone, like, don't feel like we're judgmental, as a whole. Like, we get into this work because we care, we want to help people. And so it's not our place to judge anyone. We just need the information so we can make the best decisions and guide them the best way and put together the right plan. But that's just such, for me, a really important takeaway that I don't think we talk a lot about enough is that, like, you may feel ashamed. Like God knows I've been into doctor's appointments and I'm like, oh my
I
God,
know.
like I'm ashamed of this. I'm ashamed of this. Like there's always
But this is
something.
your health at the end of the day.
Yeah.
Yeah. Yeah.
And we have to, like, that's where we get to work in partnership together, right? Like, and if you have a good relationship and you don't feel like the person you're working with is making you feel small,
Yes.
that they're not like that they are actually listening to you and you're not feeling like dismissed.
Right.
Those things are really important. And I love the point about if that person doesn't exist in that system, go find one.
Yeah. Yeah.
Go find one with someone else.
Right.
I was just speaking with Dr. Mia Chorney, and she said the average woman in menopause goes through six physicians to find someone
I believe.
that they like resonate with to actually be heard.
Yeah.
That's crazy.
That sounds about right. I think that what I've people have asked me this in my concierge practice multiple times. They've asked, your average patient, is it somebody that is like brand new to mental health, or is it somebody that's kind of like this is their, umpteenth provider?
Yeah.
I have a variation. I'm their very first clinician, psychiatrist, therapist, all the hats that they've ever seen. And because I am so vocal on social media, so the lead time to it is at least 6 months before they can make the decision to call me on that first discovery call.
Okay.
But they've seen me in action. They've, heard me on a podcast, or they've seen me on Instagram or LinkedIn, and they finally feel like, okay, I can resonate with her. I think I can trust her with, my issues.
With my deep dark secrets.
With my deep dark secrets. And feel no shame in that, right?
Yeah.
The other is I've had patients where I'm their 10 plus clinician that they've ever seen, or more. And they have finally found somebody who actually takes their time, that doesn't just order a Band-Aid for every single symptom.
Yeah.
Or side effect. And we're working on things on a whole person level. I'm not just saying, oh, you have poor sleep, let me throw something at it. We're saying, why do you have poor sleep? I want you to purchase a wearable, and if you have a wearable already, I want objective data, and let's see what's going on. And let's see if there's any underlying issues, because is there apnea? Is there something else that's underlying that's frequently waking you up? Or are you just, there's too much going on?
Yeah.
And we deduce and we kind of tie all those things together, but that's what's important for those individuals. And mind you, not everybody has the luxury of going through concierge or DPC, but for those that do, I hope that this is a creation of a whole other beast that a lot of us are creating and throwing out everything else out there, because we went to med school and residency and fellowship for a reason. We wanted to help people. We didn't want to help people under the systems and the chains under the systems.
Yeah. You want to practice your authentic self and care for people.
Right.
I know you just spoke about how, right, not everyone can afford either of our services. And that's, I know for me, it's really hard as a nurse. Like, I want us to be able to provide care for everyone. And I hope I can get to a space one day where we can. With the system that we have now, it's not possible. But even though it is cash pay, there is still a tremendous amount of value.
Yes.
And like, I have to think about it sometimes, like, oh my God, like if you call a plumber to come out to the house, it's like 200 plus an hour for like help with your plumbing. We pay for it because we need it.
Yes.
Right. And it's in the moment, like you have no other option when your pipes burst, right? That's what you have to do.
That would be thousands of dollars instead.
Right.
Mm-hmm.
But like, if we took the time to invest in having someone help and sit down and really dive into the root causes of everything we're experiencing, that value could be so much more.
Oh, it absolutely is.
Right?
It absolutely is. I've had patients that have come in that have been hospitalized recurrently through multiple different providers, all of which were really mistreating and the situation and the disorder, and not really addressing lifestyle and all of the other factors. If you think about the number of ER visits a single individual had, the number of psychiatric hospitalizations, the time, the effort, the FMLA, the short-term disability, the loss of revenue that they were having because they couldn't work, they didn't have a business, they couldn't function in their family and in their dynamic and their soul, family units, relationships dismantled. If you had had somebody that listened, at the end of the day, to me, even though, yes, direct primary care, direct practices, cash pay might seem like it's expensive, in the long run, you paid for that plumber to fix that little, whatever that pipe before it burst. That burst pipe would have flooded the house, would have caused mold, would have caused, right? So many
Yes.
different layers of factors. And people aren't at that stance yet where they understand that because they're like, well, I pay hundreds of dollars a month for my health insurance.
Yeah.
I'm just going to see my provider.
I don't blame them either.
I don't blame them, but you've got to find the good one. And more providers, especially in certain specialties, are just saying we're doing cash pay.
They're leaving. Actually,
leaving.
my dad, I was talking to him this last week, and his primary care provider is now stepping away and doing all cash pay only too. And he was like, I'm like sad that she's like doing this, but he's like, I'm actually happy for her. But my dad's at a position where like we can make sure that he has that, right?
Sure.
Like he'll be able to like have access to care, but not everyone does, right? And what about all of her other clients that she cares for that now they've got to build a new relationship with someone else? And it's kind of like in healthcare when I had this happen when my primary care died, right?
Oh.
I was the last baby that he actually gave birth to. He was a PCP,
Oh
if that says anything about my age. So when he died, I was like, I've been seeing this guy my entire life. Like, where do I go to now? And anytime there's a transition, like either your insurance changes plans and that doctor's no longer covered anymore, or they move or something, any disruption, then it's like you feel like you have to start over from zero. You have to try to find someone and then build a relationship with them. And that takes time.
It does. And it's annoying.
It's annoying. It's so hard.
And you find, and like you said, I mean, if the average is 6 for a woman, for example.
Yes.
And I'm guessing for a woman that's probably across the board, OB-GYNs and primary care doctors. It could lead mental health, endocrine, whatever we have to deal with as women. But that doesn't surprise me. And it really is a testament to where our healthcare systems are right now. And that's awful. It's hard. Short of somebody passing, it's the daunting thing is if you switched insurance from one plan to another, or that plan is no longer right covered with that particular office, and they said, well, our reimbursement rates dropped by like 50-60%. We are no longer taking this payer, so bye. Sayonara, find another office. You're like, whoa, but I pay health insurance all these hundreds of dollars for a reason. Now I am forced to look for somebody else. I mean, these are things that go on and underneath the surface and the back end. And the systems also feed each other. And I don't think patients really know that they're kind of this particular insurance payer and this particular system have a really great connection, and they're feeding you to this particular pharmacy to go get your medications. That pharmacy's number of medications, or the not to say that there's kickbacks, but in a way, to me, if one pharmacy is over another and you could have gotten it cheaper with that one, why are we monopolizing it and not giving a patient all of the potential options? So there's a lot of shenanigans, unfortunately. And at the end of the day, what really disheartens me is that it's patients' lives and their care that we're dealing with and we're gambling with at the end of the day. And I was not okay with that, being on the, in the leadership roles.
Thank you for raising that point. I think people are starting to see this a little bit more now than they have in the past. But I think for us as nurses, like when I think about our role as advocates, there's never been a more important time to have an advocate who looks out for you. I wouldn't trust my own family member in any hospital without an advocate to check in on them and make sure they're okay. And even to have someone go to their doctor's appointment and make sure all their questions are asked. Because if they are working in a practice where they have to see 40 to 50 people a day, you've got to have all your, like, what are all your questions? What are all your thoughts? And have someone who can think about things faster, that knows and understands, because you're not going to think about it until you get home tonight, or maybe in a week after you've looked at some stuff online of like, what does this really mean? But if you can bring someone with you to your appointments, you can get your questions answered, have someone advocate based on what you want,
Yes.
not what they want.
Yes.
It's so critical.
It's so critical. Even if it's like a friend or a family member that has clinical competence.
Yes.
And I did that the other day with a friend of mine who had to have an emergent surgery. And I had a very simple question for the physician. We waited over 40 minutes for them in the office, and there wasn't really anybody else there. So I'm not sure why we waited so long. That's fine. Typical, healthcare setting. And why I was asked to come was because I was asking her certain questions while she was in the hospital that she didn't know the answer to. And so I said, why don't I come with you to your follow-up visit? It was post-op, and I can help kind of like navigate certain things, and we'll see how it goes. And it was like one foot was already out the door of this physician and it was the dismissiveness, it was a lot of gaslighting, it was really daunting. And I was really livid on the drive home actually from this appointment. It wasn't even my appointment, it was my friend's appointment. And I was just thinking, like, we're in 2026. We're past COVID 6 years. Why are we still here? We've gotten worse. To me, we're just kind of like downtrending. We're just getting to a point where I don't know what it is. It's so many systems and things that are really daunting on every single level. And one of the questions that she had at the very, very end was related to billing. And the physician just said, "Oh, I don't deal with that." And so I had to do a little woosah, little mindfulness moment for myself. And I thought to myself, despite you not knowing, didn't say this aloud, but despite you not knowing, this is your practice. You're a partner in this practice. Refer her to your front office staff that are literally 2 to 3 feet away. Not dismiss and say, "I don't deal with that," or "That's the hospital's issue." There's a lot of this going on, and I feel like it's just, again, it's discrediting physicians, it's discrediting providers and care and what we can deliver, and it hurts us as an entity. And that was a big part of the reason why on social media I wanted to get out there on a platform, because we've got people that have no influence whatsoever that are calling themselves influencers for wellness and care and clinical medicine and talking about all these things, that have not gone through the training that you and I have had, that don't have the experience you and I have had, that have not dealt with the intricacies and nuances of patient care and the systems at play, to just say, right, like, this is what your treatment plan should be, and this is what you should be taking, and that's what's going to help all of mankind. That doesn't work. There's so many different layers to it.
Yeah.
So,
Well, I can definitely attest to following Dr. Mona Amini on social media to learn more, because you put out like such great content. Like, you put out a mix of like the fun, but you really like you spend a lot of time blogging actually, and you put together great articles, super informative, and I think a lot of your content is really empowering for people, and it's really like opening the door to like, here's a different lens. Here's the truth, right? Here's how it's really happening. So I definitely encourage people to follow you to learn more, and just like think about the sonic immersions. Like, obviously not everyone that's listening is probably in Phoenix or here, but any like final thoughts or recommendations that like you'd love to give anyone anywhere listening in?
I think in terms of patient care, really one of the biggest things that I can tell anybody anywhere for any setting specialty is speak up and speak your mind. If you're feeling that you are not resonating and you feel like your physician or your clinician is not listening, you have an option to get a second opinion. You have an option to find another office. And you don't have to stay with that therapist or that provider, because at the end of the day, this is your health. And if you're not feeling like you did the research, you used the AI and you found like, okay, I dug up some stuff. I'm going to take this to my doctor now, and now we have to investigate this further. That's great. Utilize that to your advantage. But don't also forget that you have options and you have to advocate for yourself. And if you can't, bring somebody along that can advocate for you.
Yeah, 100%. And actually, I've used ChatGPT. I use Claude.
Yeah,
That's actually
I converted to Claude.
she's my preferred
Yes.
source.
Yes.
But I'll dive into like help make recommendations based on like ratings, or there's CMS for people that do get coverage from like Medicare, or they get paid by Medicare, right? Their ratings are going to be online. And for surgeons, like looking at their like recoveries and infection rates, like
Correct.
those sorts of things are out there and available for people. And so using Claude that can pull from these resources to help kind of narrow down the choice if you have to. But honestly, I laugh every time I think about this. But there's a group here called the State 48 Nurses Group on Facebook. And I'm like, we should make this like public in some way. But like, we ask each other, who do we go to for this?
Interesting.
Right. And so nurses know who we want caring for ourselves and our own loved ones so well. Because we watch and see it all happen. So even if you just know a nurse that you're like, hey, who would you recommend for this?
Yes.
Like, or another physician, or
We
another
have physician
provider,
groups too on
right?
Facebook. Yeah, we do the same.
Same
You do the same.
thing.
Hey, in this part of the valley, I need a GI doctor for whatever purpose. And then there'll be blasts of everyone because it's a connected network. It's wonderful.
Yes.
And especially the female physician networks are even more
Oh,
helpful.
I'm sure that's really important.
It is.
Okay. I wish I could sneak peek into there too, but always ask a doctor or nurse or someone in your family for who they would recommend. And I think that's like the best way to do it. But
Agree.
yeah, good. Any like last minute thoughts or anything that you want to share? You're
I'm
good.
truly appreciative of having you have me interviewed here and being in this space with you. Really, it's been a wonderful conversation. Thank you.
Oh my gosh. Well, thank you for being here. And I'm really excited to just honestly watch the work that you're doing explode.
Thank you.
Like, I think I went to your last one it was probably like a few weekends ago. And I sat there thinking, like, I can't wait until instead of just being like 20 of us, there's like hundreds of us, because this work is so powerful. So
That's the vision.
for everyone who's here in Phoenix, she please follow her, take a look at when she has events coming up, and definitely participate. They are so amazing. So thank you for being here, and thank you for the work that you're doing.
Thank you.
Yeah. Just as Dr. Mona Amini stated, music is ancient, so is movement. They're powerful in their modalities of healing that we're now just starting to reintegrate back into how we see and treat the whole person. Please remember, as Dr. Mona Amini stated today, use your voice. You have options. You're not limited. And for those of us who are clinicians ourselves, let's follow her as an example of what care and practice can look like if and when we step outside of the traditional boundaries of what we think we've always had to practice within.